Corns and calluses are a buildup of hard, thick areas of skin. They often form on the feet, hands, or fingers. Corns and calluses are the same tissue. Corns are small and round, often on toes. Calluses are larger and flatter. Calluses are hard, thick patches of skin. Compared with corns, you're most likely to see calluses on the bottom of your feet on weight-bearing areas.
Some degree of callus formation on the bottom of your foot is normal. You'll also see calluses often on your hands. For instance, a callus form.
What are the different types of corns? One common type is hard corns. These are small, hard, dense areas of skin that form on the top of your toes.
Soft corns are whitish or gray with a soft, rubbery texture. They appear between the toes. Seed corns. These corns are small and usually form on the bottom of your feet. Corns and calluses have distinct features. Corns are small, round area stems. They're caused by friction and pressure. Calluses are thick, hardened, larger, and typically more flattened patches of skin. They are less sensitive to touch than the surrounding skin.
Both corns and calluses can cause hardened areas of skin from repeated friction and pressure. This can lead to pain, redness, and blisters.
Corns and calluses may or may not be painful. Some become painful over time as they thicken and become tender to pressure. Sometimes, cracks called fissures form in a callus. They can be painful. If a corn or callus becomes infected, you'll feel pain or discomfort.
What causes corns and calluses? Corns and calluses have many of the same causes. These include shoes that don't fit properly.
Shoes that don't fit properly. This is the most common cause of corns on the top of your feet.
Tight shoes cause painful friction and shearing. High heels create intense pressure on the ball of the foot. This often leads to calluses forming on the skin.
My legs feel stiff. My feet are getting tired. I'm getting so tired.
Going barefoot can cause corns and calluses. Sports activities like tennis can cause them too, and work or labor. Another reason for corn and calluses, not wearing socks, or socks and shoe linings that slip and bunch up.
Improper posture, like walking too heavily on the inner or outer edge of your formities such as bunions or hammer toes, can cause corns and calluses. Corns and calluses develop from repeated friction, rubbing, pressure, or irritation on your skin. This causes the skin to thicken and harden.
And on hands from rubbing.
The hardened layers of skin of corns and calluses are actually your body's way of protecting the underlying skin from irritation and pressure. Who is more likely to get corns and calluses? Someone who wears tight shoes and stands a lot, or someone who wears comfortable shoes and takes breaks?
You're more likely to develop corns and calluses if you have medical conditions that change the normal alignment of the bones in your feet. Corn and calluses can be developed if you walk without socks. You wear shoes that are too narrow for your foot. You have atrophy or loss of your natural cushioning.
Untreated corns and calluses might grow larger until you fix what caused them. Corns or calluses can cause infections. This can make walking difficult. You may need antibiotics or even surgical treatment.
Corns and calluses are diagnosed by looking at your skin. No tests are required. A simple visual exam is enough. How much walking and standing do you do? I stand a lot at work and walk about 30 minutes daily. Please walk for me.
Treatment depends on the cause, but for a typical corn, removing the buildup is effective. This removes the thickened skin.
Soak the area with the corn or callus in warm water until the skin softens. This usually takes 5 to 10 minutes.
Gently move the pumice stone across the callus in one direction. Be careful not to remove too much skin. This could lead to bleeding and infection.
Surround your corn with donut-style adhesive pads. You can purchase moleskin padding at your local drugstore. Padding helps protect the corn from irritation.
Wear properly sized and shaped footwear. Keep your toenails trimmed. If your corns or calluses are painful, apply a cold pack. Never try to cut out, shave away, or remove corns or calluses with a sharp object. Don't try to treat corns if you have diabetes.
After corns and calluses heal, can they come back? Yes, corns and calluses are caused by friction, irritation, or pressure against the skin. You should see your healthcare provider if you have corns or calluses and you have diabetes or other underlying diseases. So, see your doctor. See healthcare provider if home treatments don't work, if you suspect abnormal bone structure, if your corns or calluses are painful, or if your foot pain is intense.
A plantar wart on your foot looks like a callus with tiny black dots. Warts are caused by a virus, while calluses are from friction.